My name is Joyce Dominguez, and today I'll be performing changing a central line dressing. So the first thing that we're going to do is review our medical order and the facility policy. We're going to gather our equipment, which is our dressing change and our gloves, hand sanitizer, and sterile gloves. Then we're going to identify the patient. Hi, my name is Joyce. I'm your nurse today. Can you tell me your name and your date of birth? Alright. So today we're going to be changing that old dressing on your central line today. Get it all cleaned up. So provide for privacy, and then I'm going to perform hand hygiene. Then I'm going to position the bed to a comfortable position, position the patient in a comfortable position, and elevate the head. Going to make sure our waste receptacle is in an appropriate location so we can reach it. We're going to have our patient put on a mask, and we'll put on a mask ourselves. And if they can't tolerate a mask, we will have them turn their head away from the insertion site, or the insertion site. So the next thing that we're going to do is we're going to put on clean gloves. And we're going to start to remove our old dressing. And once we get to a place by the catheter, we want to stabilize the catheter while we cool the dressing. Alright, and I'm just going to leave it covered for now until I get my supplies prepared. I'm going to remove my gloves, perform hand hygiene, and then I'm going to get my stuff ready. Alright, now I'm going to take the remainder of the dressing off now that I got my supplies ready. Remove my gloves, put the sole dressing inside, perform hand hygiene, and now I'm going to put on my sterile gloves. I'm going to take my chlorhexidine swab. I'm going to crack this, and then starting at the insertion site, I'm going to scrub for at least 30 seconds. And then I'm going to do at least a 2 to 3 inch circle around the site. And then I'm going to let that dry. Then I'm going to use my skin protectant around the surface that I cleaned. Let that dry. And then I'm going to use my alcohol swab to clean the catheter. And with my non-dominant hand, I'm going to clean one side, discard, clean the next side, discard, how many ever times it takes to get it really clean. And then I'm going to get my Tegaderm dressing. And I'm going to put it over the center of the site. And I'm going to make sure that it has a really tight seal. I'm going to go along the edge to make sure we just maintain that tight seal all the way around. Alright, and then we're going to date the time, the initials and the gauge. Well, not the gauge, but the date, time, and our initials. Put that on a spot where we won't see, where we can still see the site. We're going to lower the bed into the lowest position, make sure the patient is comfortable with the side rails up. We'll then remove our gloves, perform hand hygiene, and we'll document the procedure.